So please, let's have AGC welcome to Dr. Courtney Padjen. This is for you.
Well, thank you for having me and that introduction. As we get started, let's all together, take a breath with me. Now, I want you to imagine taking a dissociative medication with psychedelic effects that has the potential to not only improve your relationship with others, your relationship with yourselves, but also your mental health. That may sound a little wild and a little bit out there, but I can tell you with absolute confidence that taking a therapeutic dose of ketamine was one of the best life decisions I have ever made. Let's back up for a minute. As I say, I took a dose of ketamine. I didn't actually take it. It was injected into my arm by a medical professional, and the dose was predetermined. And after that time, I was under their care and supervision for the entirety of the journey. So, you know that feeling that you get when you're at the top of a roller coaster? If you like roller coasters, I don't. And you're about to take that plunge, and then you feel your belly and your throat, and you're excited, but you just can't talk. That's exactly what happened within the first 5 minutes of my ketamine journey. And then, after that, time was lost, and I was on a quest. The medicine was taking me exactly where it wanted to go. At some point, I remember I was floating above the universe without a body, and then sometime later, I was just one with the ground, watching the entire world walk all over me as if I was under a giant pane of plexiglass. I had later learned that that is referred to as ego dissolution. So later, I recall a time being on this journey where I was in a gondola, but I wasn't going up a mountain of any kind, but instead traveling sideways. And each stop was a still shot photo. And it was just okay, next. Almost like those little toys we used to play with. When the picture would change, new image shows, just like that. The funnest part of my journey, I remember at one point I was in a kaleidoscope. It was part of the kaleidoscope. And then a couple seconds later, I was like, I am a kaleidoscope. I'm a lava lamp. And then I could see the blood platelets that made up my body. And it was whoa, this is part of me and who I am. And then it got really dark. And then the darkest part of my journey, I remember seeing a life-size still shot photo of a childhood trauma that I had experienced when I was about 1.5 years old. And it was very clear, despite the fact that the image was made of those black and white fuzzies that we would see on a television after it had gone off broadcast for the evening. And then within a matter of seconds of staring at it, it turned to ash and just fell to the ground, as if to say, this is no longer a part of your identity. Let it go. There was some of the clearest moments of my journey that I can recall. And then at other times, there was just a lot of green and a lot of geometric shapes. And I felt like I was in the Matrix. And that I learned is a common phenomena in ketamine journeys, as they have psychedelic effects. Even though this quest had lasted an hour and a half, typically, it felt like only minutes had passed by. And then once I came back to my body and I was starting to have dialogue with the doctor and the therapist that were present, it was like, why am I even talking right now? Am I even making any sense? I was there, but it was still am I here? I'm okay, pinch me. So when I do psychedelic therapy, specifically working with ketamine with clients, I always tell them, You're not always going to have these like profound aha moments during your journey, but to be mindful of the subtle changes that take place afterwards. In the following days after my ketamine journey, I was very intentional to literally take the entire week off of work. And in that time, I noticed I was kinder to myself. I was more patient. I was more quick to shut down negative self-talk. And then I was also more attuned to my emotions as well as welcoming to them, even the ones that were more uncomfortable and challenging. So before I go any further into this revolutionary medicine, I feel like I should probably talk about its origin and its original function, because that in itself is kind of, whoa. So when ketamine was created, it actually wasn't ketamine. It was derived from PCP. So ketamine is primarily used as an anesthetic for surgery. Ketamine in very high doses is an anesthetic. Ketamine in lower doses is a dissociative medicine that, well, not medicine, but a dissociative that causes psychedelic effects. So it was PCP was the most commonly used medicine, and then as doctors noticed, like people coming out of their anesthetized states are really sometimes kind of violent and out of control. And if you've ever noticed videos of folks who have done recreational PCP online, they are also violent. This was being observed in patients that were coming out of surgery. So in 1963, someone had, I forgot who, had tinkered with the chemical composition of PCP, and from that, ketamine was derived. So then it became this really amazing medical tool. It also became a really amazing asset for infantrymen in the war zones. So if you were in war and you were on the battlefield and you had been shot or had a limb blown off, you would be really happy. Well, not really happy, but you'd be really grateful probably if your comrade next to you had a shot of ketamine. He would shoot you up, and then you would not be consciously present that you had been shot or had a limb blown off while you are carried to safety. Pretty incredible stuff. So eventually ketamine naturally worked its way into the party scene, and sending people in K-holes, and then there was the war on drugs. And then more than 2 decades later, in 1999, ketamine was classified as a Schedule III non-narcotic medicine that was used for medical use only, or there was the hope that it would only be used for that. Fast forward into 2019, and the ketamine being used for treatment-resistant depression skyrocketed. Currently in the state of Minnesota, ketamine is the only medicine of its kind to be used for mental health purposes, and it helps with a variety of conditions such as depression, anxiety, PTSD, OCD, eating disorders, as well as substance use disorders. And then there's more off-label uses that it's beneficial for, including having a deeper sense of connection to yourself, deepening your relationships, or having a deeper sense of empathy, not only for yourself or other people. So you might be wondering, like, how does this stuff work? I'm not gonna bore you with all of the jargony medical talk, but instead we'll share with you an analogy that's commonly used in this line of work. And if you can imagine, your brain is a ski mountain, not a hill, but a mountain. And your thoughts and your behaviors, your knee-jerk responses, your behaviors, those are your well-traveled trails. When you introduce ketamine, it's as if a fresh blanket of snow gets dumped on your ski mountain, and that allows you the opportunity to grow, well, not grow, but develop new trails, new ways of thinking, new ways of behaving, new habits, new patterns. And so one thing that we like to emphasize in the ketamine community is this idea of neuroplasticity, because that's exactly what's happening. And within 10 days following your ketamine journey, that's when it's most important that you do not engage in any depressive activities or something that's non-helpful, because this is the prime time opportunity to start to integrate habits that you really want to incorporate into your life. So, again, I don't want to glamorize the effects or the experience of ketamine. Yes, mine was beautiful, but it can be beautiful and insightful for others, and then for other people, it can be terrifying and scary, but also insightful and terrifyingly insightful. And then processing afterwards is also important. But, you know, in the ketamine preparation session, preparation is a thing, and it's part of the pre-journey journey that is strongly recommended. And I want to again emphasize that you can prepare as much as you prepare with your mental health professional. The medicine will take you where you need to go or where it wants you to go, not necessarily where you want to go. So my preparation journey was not typical. I have my own mental health professional, but I wasn't working with a ketamine therapist. I did this as a part of training. This was an experiential for me, and it was like, you can do this as a supplemental part of your training as an option. And I'm like, if I'm going to tell other people to do this and it's going to be beneficial, why would I not do this to know how it feels so that I can give them an idea of what you're really getting yourself into? So I didn't have a typical prep session that, say, maybe one of yous would if you were working with a ketamine-assisted psychotherapist and going on the journey yourself. So in preparing for a ketamine session, you would meet with a mental health professional and go through your standard like diagnostic assessment and all that jazz. And basically what we're doing is we're trying to rule out certain diagnoses that would potentially make you a not good candidate. So depending on like the severity of those diagnoses or how well they're managed or not managed, that's going to be part of the determining factors. So then following that, if it's like, yep, I give you the green light, then I'm going to send you over to the doctor. And the doctor is going to give you a very thorough medical evaluation to make sure that medically speaking, you're a good candidate for ketamine session. So they're going to rule out diagnoses such as heart disease or hypertension or anything that might be of concern that would be like, maybe we need to try a different route before we go this way. So once all that is done, as in the diagnostic assessment, and then once the medical evaluation is done, that's when the prep really starts. So the interesting thing about ketamine-assisted psychotherapy at this point is there is no standard way of doing a preparation session. Some therapists will do brain spotting or EMDR, others might do system-based thinking or something related to internal family systems. It's really dependent on who your therapist is. So just something to keep in mind, that the work that you want to do might be the type of approach you want to take with your therapist, and that might be a determining factor in the process. So another thing that is variable in ketamine, not only in the approach in which it's done with regard to therapy, is the means of administration. So once the doctor says, yep, you're a great candidate for ketamine, they will be the ones to determine the means of administration as well as the dosage. These are determined by, say, someone's weight, their height, as well as their previous experience with psychedelics. So the day of the journey, that's all determined. The doctor knows how much you're taking, how you're taking it, and then it's time to go on a ride. So depending on the means of administration, within 5 to 15 minutes, you're gonna be on a journey. And well, I can't say how it's gonna be, but I hope it's wonderful and wild. And despite ketamine's versatility with regard to the administration and its uses, and the approaches that it takes to do this work, it needs to be understood that ketamine is in no shape, way, or form a panacea. It's not a wonder drug, and it's merely a catalyst for change. It's to help, not to fix. So, with that said, I wish you a happy journey, and thank you for listening.